Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this episode, Dr. Sarah Mashburn, a practicing OB-GYN, talks to us about IUDs, or intrauterine devices.
Hello, good evening. I am Dr. Dana Bach. I am a board-certified anesthesiologist. I practice at Lakeside Women's Hospital, and I have for a fairly long number of years. Tonight, I have one of our new OB-GYNs. Her name is Dr. Sarah Mashburn. Hi, Sarah. Shout out.
Hi, thanks for
She will
having
be.
me.
We're happy to have you today. I'm glad you're on here to visit with us. She wants to visit with us today about IUDs, and I'm going to let her start off and answer some of the most frequently asked questions she gets asked in the office from patients. But let's first start off with, what does IUD stand for?
So IUD stands for intrauterine device, which basically means that it works inside the uterus. So it's a little flexible T-shaped device that can be placed either in the office or under anesthesia that sits up at the top of the uterus and provides both contraception or birth control. And some types of IUDs can also be used as a management for heavier periods.
Okay, perfect. And give me some examples as to why someone might need it.
Yeah, so I think probably the most common reason that we see people choose the IUD is because they're wanting something that's going to be long acting but reversible. So IUDs fall under the birth control category of LARCs, or long acting reversible contraception. So depending on what type of IUD you choose, there are IUDs that are effective anywhere from 3 to 10 years. And they provide a reliable method of pregnancy prevention without having to remember to take a pill every day. So that's probably the number one reason that I see people choose it. I also see people choose the IUDs because maybe they've tried other forms of pregnancy prevention in the past and had side effects that they really weren't crazy about. And a lot of the IUDs offer little to no systemic side effects because there is a hormone-free IUD, but even the hormonal IUDs act locally in the uterus, so we see way less of the side effects that we can see with other forms of birth control.
Excellent, excellent. And can you pick and choose which one lasts from 3 to 10 years? Is that something, I guess, patients would talk with you about? How long?
Absolutely. So a lot of times, I tell patients, if you think that you're not going to want pregnancy for several years, we should choose one of the ones that last longer. However, even if you think maybe I want a baby in 2 or 3 years, there's still some benefits of the longer lasting IUDs that might make it the right choice for you, because the good news is that we can take it out at any point, whether you're ready to have a baby or if it's just not the right fit for you. We can take it out prior to that, 8-10 year mark, if you'd like us to.
Okay, perfect. That was my next question, was what if I use it and in 5 years I'm done? I think I may want to have a baby. Can I just have it removed? And how easy is that?
The removal is super easy. I think people are often surprised at how quick it is to remove it in the office. And the good news is that your baseline fertility resumes pretty much instantly after the IUD is removed. So most people still can ovulate on the IUD because that's not the primary way that they work. They work kind of locally within the uterus. So once they're gone, you're kind of back to your baseline fertility. And so people can start trying to get pregnant again right away.
Okay, perfect. And is it uncomfortable when you remove it or when you place it?
The removal is typically not as uncomfortable as the placement can be. But one of my favorite things to talk about is, I think, especially over the last 5-10 years, we've learned a lot about IUD placement and ways to try to make patients more comfortable in the office with IUD placement. So when I talk to someone about, options for anesthesia during IUD placement, I tell them that we usually try to combat it from 3 different ways. So I always offer people a one-time dose of a medication for anxiety, that as long as they have a ride to and from the office, they can, I will prescribe them a one-time dose of an anxiety medication that they can take when they check in the front desk. And then it's usually taken effect by the time they get back and are ready for the procedure. We also typically give an injection of a medication called Toradol that we can give as a shot that helps quite a bit with the cramping of the procedure. And it helps not only during the procedure, but helps for cramping that can be, that can occur after the procedure. And then I
Okay.
also offer the option of a paracervical block, which is where we use lidocaine, just like when you have dental procedures done. We can inject lidocaine into the sides of the cervix that can help some with that pain of placing something into the cervix. So those are the three kind of options that I offer for people. Some people choose all those options. Some people choose none of those options. And then I always tell people that it's not like once you commit to this, you're done. If it's too uncomfortable in the office and you're a good candidate for anesthesia, like to be actually asleep in the operating room, then that's something that we can do. I do that a lot for, I have a lot of teenagers that decide that IUDs are the best fit for them, and they're really nervous because they've never had a pelvic exam before. And so it's always an option if they're healthy enough to undergo anesthesia in the operating room for them to be asleep for the whole procedure.
Okay. Okay. Perfect. So there are plenty of options. And then as far as removal, it's normally done in the office, and it's an easy
Typically,
thing.
yes, the removal is really quick, especially, we just typically grab onto the strings, have people cough and pull it out, and people are like, wait, that's it. And you show it to them to prove that it's out. And people are usually pretty shocked that it was that easy.
Okay. If I had one placed, will I notice it? Would I feel it as a patient?
Most people do not, especially when they're in the correct location. You may have some cramping or some kind of twinges as your body's getting used to having this in place. But most people that have had it in place for even, a couple days, couple weeks, couldn't even tell you that it's there.
Okay. Perfect. Are there any side effects?
So probably the most common thing that I talk with people about in terms of side effects is the bleeding profile can take a little bit of time to establish itself. So this isn't something that we place and then your periods immediately go away. But rather I try to talk to patients about expectations with their bleeding so that they know kind of what to expect over those first few months. So, at the 6-month time period, when they did these big studies, 65% of women had absolutely no bleeding at all with the progestin IUDs. So the progesterone containing IUDs. So for that, that's not even including like a single episode of spotting a month. So that's a really good, considering 65% people have no bleeding at all. That's really good.
Yeah,
But
that's
that is,
excellent.
yeah. And so, but that is at the 6-month mark. So I tell people, you may be lucky that we place this and you don't ever have a period again while it's in place. Sometimes people continue to kind of have light periods up until the 4 to 6 month mark. And some people have, intermittent spotting that's unpredictable. And there are ways that we can try to combat that to try to get you to that 6-month mark. But I tell people if you can make it to the 6-month period, the satisfaction rate with IUDs is like upwards of 95 to 98%, depending on the study. So if we can get to that point where your body's adjusted to it, people tend to really like it.
Okay, perfect.
But we don't typically see the same side effects as we do with some of the systemic hormonal birth controls. So, IUDs have not really been associated with weight gain or mood swings or risk of getting blood clots in your legs or your lungs. So those are really nice things that some people want to avoid those side effects. Anytime we're switching from like one form of birth control to another, sometimes there's side effects from stopping oral birth control pills while we're, waiting for the IUD to adjust. But in general, since it works locally in the uterus, really your main side effects are going to be some unpredictable bleeding as you adjust to it. And for some people, that cramping while you're getting used to it as well.
Okay, perfect. Is there anything that we haven't talked about that you want to mention about an IUD?
I think we haven't talked as much about maybe the non-hormonal IUD, which is the Paragard is the brand.
Okay.
So this is a copper-containing IUD that works a little bit different than the progesterone one. So the progesterone one works primarily by thickening the cervix mucus so that sperm can't enter the uterus at all, and then it thins the lining of the uterus so that it's not a compatible place for pregnancy.
Okay.
Whereas the copper IUD tends to create more of a local inflammatory environment where the sperm cannot survive in the uterus. But the copper IUD doesn't have really the same effect on the lining of the uterus as the progesterone one does. So people tend to still get their periods with the copper IUD.
Okay.
So sometimes, as opposed to potentially not having a period or having lighter periods, copper IUDs can result in your period maybe lasting on average 1 to 2 days longer, potentially being a little heavier or crampier those first couple of days. But there are some patients who really want a reliable non-hormonal option, and so the copper IUD is a really good option for them. And
Okay.
that one is beneficial up to 10 years. And then the only other thing we haven't talked about with IUDs is that they're actually both types of IUDs have been approved as forms of emergency contraception. So if you have unprotected intercourse and you're wanting to prevent pregnancy after that, we actually can place either of these IUDs in the office within 7 days of unprotected intercourse.
Okay.
And not only hopefully prevent unwanted pregnancy in that moment, but then offer you long lasting protection so that we're not having to, consistently seek out emergency contraception.
Okay. Do either of these provide protection? You were talking about an unwanted pregnancy, but what about STDs?
So, unfortunately, they do not provide any protection against STDs. The only form of contraception that provides STD protection would be condoms. So, we definitely still recommend continuing to use condoms if there's any concern with new partners or any, high risk behaviors that would be at increased risk of getting STDs.
Okay. Okay. That's all the questions that I can think of. I think you've done a great job of explaining the differences and how it works, how it's placed, how it's removed. Anything else you want to add?
I just want to add that I think that there's a lot on social media about IUDs, and it a lot of times tends to be more negative than positive. It seems like that's maybe the more outspoken crowd, which is super reasonable. People have something they go through and they want to talk about it. But I just encourage people, if that's something that they're considering or if they have questions, to ask your provider, because I love talking about myths versus facts with IUDs or any form of contraception. And I don't ever want people to be ashamed to ask about something just because they saw it on the internet. We know people are on the internet. We're on the internet. And so it's always good to bring up those questions or concerns.
Oh, yes, I totally agree with you, Dr. Mashburn. It's sometimes when I'm asked questions, I think, where did that even come from? But it's important to answer those questions and provide medical knowledge, which you do this every day. Every day of your life, you're taking care of patients, and you have been trained and you know the facts. And so that's what you're there for. So of course we want patients to ask those questions.
Absolutely.
And I know that you do a good job of explaining and answering those questions for them.
Well, thank you.
You bet. Thank you so much for being with us today, Dr. Mashburn.
Well, thank you
Have
for
a good day.
having me.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health.